Welcome to this press briefing on the outcomes of the 16th Southern African Civil Society Forum, jointly organized by SATUCC, FOCCISA, and SADC Council of NGOs. The Civil Society Forum is organized to bring together all formations in the SADC region to speak out and voice their demands in response to the situation and context pertaining to our countries at this time. We'll begin this press conference by having a short prepared statement read by the representative of EJN FOCCISA, Mandla Khadebe.
The 40th Ordinary Summit, held virtually for the first time, occurred at a time of acute global crises, described as an existential crossroads involving a pandemic, a deep economic recession, devastating climate change, and extreme inequality. SADC leaders and member states confronting these crises were urged to reset the fundamentals of regional integration and move speedily towards a community upholding and respecting human rights, advancing and promoting socio-economic justice, and building a strong, resilient, and self-sufficient economies which serve all people. We, civil society in the region, recognize that the inequalities and inequities within and between countries are structural and systemic, particularly gender, race, and class-based inequalities. It is vital that responding to the pandemic does not exacerbate and worsen these inequalities. The virus does not discriminate. However, its impact will be felt disproportionately by the poor and vulnerable in our society. A regional emergency plan of action, therefore, supported by a SADC COVID-19 relief fund, is required, which is integrated, regional, continental, multi-sectoral, multifaceted, and in order to arrest the spread of the virus, must mitigate against its impacts, providing a platform for a new social contract and making us less susceptible to future pandemics. We urge all member states to resist using the measures necessary to combat COVID-19 for narrow political gains or to roll back civil and political space. A rights and equity-based approach is essential in effectively combating the spread of COVID-19. Restrictions placed on society must be consistent with the UN Economic and Social Council, SATUCC principles, based on scientific evidence through the least restrictive alternative, subject to review and in line with the norms and standards of open and free society, which includes freedom of the press and respect for human dignity. Restrictions which target persons or groups unrelated to the public health necessity during this period must not be allowed by those in authority. In this regard, the entire civil society in SADC expresses deep concern and alarm at events unfolding in Zimbabwe. We call on the government of the Republic of Zimbabwe to immediately release all the trade union and civil society activists who are in detention for merely exercising their right to peaceful assembly and association. Restore and uphold civic and political rights in accordance with that country's constitution, commit to credible social and political dialogue with stakeholders and role players to find appropriate responses and shared actions for sustainable recovery, to address the justified concerns of health workers, to provide protection against the risk of COVID-19 virus at work, to also publicly dissociate from attempts at classifying of trade unions and civil society organizations in Zimbabwe as terrorist organizations. The denial of basic human rights and freedoms in Zimbabwe is a matter of regional concern for all of us. We extend our full solidarity to the people of Zimbabwe. And furthermore, we call on neighboring states, particularly South Africa, to ensure the safety and well-being of Zimbabweans and other non-nationals within their borders. We reiterate our call to the government and people of South Africa to combat xenophobia and violence against Africans in that country. We urge all role players in South Africa to act in accordance with their constitution and in the spirit of solidarity, which contributed immensely to that country's freedom from apartheid tyranny. We further urge SADC to activate the mediation reference group to assist in supporting its response to the ongoing instability in parts of Mozambique, and to undertake the urgent development of a multi-stakeholder component of the SADC Early Warning Unit, as well as the civil component of the SADC Standby Force. We remind SADC that military interventions will not produce lasting peace or security, and that an integrated and holistic response must be developed with the government of Mozambique, as well as local stakeholders. In this regard, we support a SADC fact-finding mission to Mozambique to engage all stakeholders coordinated with the support of the incoming SADC chair, President Newsom. Our common goal is to mobilize our people, especially women and youth, in a movement against corruption for improving public accountability and maintaining peace and stability throughout the region and in all spheres of society, including food security, climate change, and adequate nutrition and social well-being, as committed to in the Sustainable Development Goals. Special measures must be developed by member states to prevent malfeasance, corruption, and graft of COVID-19 relief funds, and swift action must be taken where these are found to happen. We further note with concern that decades of structural adjustment programs and neoliberal policies on the continent have left us and our key public health services vulnerable and exposed to the COVID-19 pandemic and the current epidemics of cholera, typhoid, and other infectious diseases due to inadequate investment in preventative health and safe water, sanitation, clean energy, and other infrastructures essential for public health, weak testing and tracing capacity and services, inadequate staffing and training in public health, weak local production capacity for medicines, diagnostics, and other essential health products, and inadequate procurement management systems, weak protection against gender-based violence, amongst others. Weak or severely limited community health systems have also been exposed at this time of crisis, as have the vulnerability of migrant and refugee communities. I hand over to my comrade to continue with the message.
Comrade Mavis, the Executive Secretary of the Southern African Trade Union Coordinating Council, representing the workers of SADC, will now continue with the statement.
Thank you, Glenn. We call on member states to carefully consider and take into account these recent calls as they deliberate on the next steps of our journey towards a free SADC, prosperous and inclusive Africa, underpinned by justice for all. The COVID-19 pandemic gives us an opportunity to build back better, more inclusive, resilient, and effective socioeconomic systems by ensuring that measures designed by member states in response to COVID-19 are rights-based and equity-based, and priorities to access to comprehensive prevention and care services, placing those most in need at the center of the respective measures. We call upon our SADC governments to ensure that the necessary health resources are pooled and shared between member states in a coordinated manner to increase and improve local production and procurement of essential health equipment, therapeutics, pharmaceuticals, and vaccines. Our governments must also ensure there is access to information on cases and to safe water, soap, face masks, and for water, food, and income support for those affected by quarantine provisions. We urge that our government responses to the catastrophic impacts of COVID-19 should be developed and implemented in consultation with all civil society organizations, as well as the most representative employers and workers' organizations. It must be ensured that all, including migrants and refugees, have access to public health services and dignified treatment, preventing stigmatization and discrimination. Our governments must ensure the provision of adequate personal protection equipment, PPE, such as surgical masks, gowns and gloves, and infection protection for all healthcare professionals and workers, including community health workers. All communities must be fully involved in the planning and rollout of public health campaigns and measures, with effective oversight, transparency, and accountability in all loan negotiations and agreements relating to financing COVID-19 responses, particularly with multilateral and private lending institutions. We urge that all barriers must be removed that impede sustained access to sexual and reproductive health services during COVID-19 crisis, including restrictions on movement for people who need critical services such as contraceptives, post-abortion care, or HIV medicines. We urge our governments to ensure continued access to the full range of planned and budgeted health services, including sexual and reproductive health services for adolescents and young people, and to earmark ample resources to prevent stockouts of essential medicines, including antiretrovirals, and make arrangements to counter trade limitations in commodities due to border closures. Measures must be put in place to detect and deter price gouging and other profiteering practices by merchants of essential medical goods and pharmaceuticals. Our governments must institute heightened safety measures for patients in waiting areas at health centers and facilitate for the provision of non-restricted COVID-19 screening and testing services by persons living with HIV, tuberculosis, and silicosis, and other immune suppressing conditions. We further urge our SADC member states to put in place a comprehensive social protection and income guarantee schemes to support small-scale farmers and the informal economy to avert the very real dangers of a loss of income and falling livelihood opportunity for the already vulnerable and precarious sectors of our society. Universal basic income grants for poor and vulnerable groups must be put in place, as well as informal workers, migrants, and unemployed. And it is also very essential to prevent a human catastrophe. Our governments must put in place mitigation strategies for both domestic burdens, economic hardship, and increased gender-based violence that needs to be implemented in conjunction with civil society and faith-based organizations. We urge that there must be an engagement by social partners and other stakeholders to effectively engage with small-scale farmers, producers, and vendors to tailor support to the sector, and that such support needs to extend across the region through SADC-wide regulations and funding. Special attention must be given to the situation of migrant workers, many of whom are particularly vulnerable and continue to be excluded from social protection schemes. Public health measures and healthcare services for prevention and treatment of COVID-19 should be available for all workers and their families, whatever their residential status. Our governments must ensure food supply is maintained, prioritizing procurement from smallholder farmers to local markets, roadside stands and informal shops, Additionally, COVID-19 regulations must consider smallholder farmers and support farm workers to enable them to produce and sell food even when local markets are shut. As SADC and the AU, they must ensure that border closures in the region do not disrupt food value chains while protecting all those involved against the risk of infection. While food production and support are considered essential services, other related restrictions will likely cause backlogs at border posts, which will require actions such as the fast lanes for maize exports from South Africa to Zimbabwe already being implemented. Our governments must expand and strengthen national and SADC grain reserves to ensure regional food security, particularly in times of crisis, and food processing and storage facilities should be brought closer to the farms. Access to information, particularly to those living in rural communities, must be ensured, and take active measures to ensure greater digital democracy by reducing data costs. Our governments must also ensure that all migrants, undocumented nationals and residents are treated fairly during this time of crisis. Governments are urged to treat all within their borders equitably in line with need and not to discriminate in providing support to the entire population. Allocations and allocate and spend at least 20% of their national budgets on education and 15% on health. Governments can raise additional funds to sustainable finance education through domestic and innovative financing for education and by taking decisive action to prevent revenue loss to debt and harmful tax incentive. There must be an assurance that education systems are inclusive, equitable, and transformative. SADC member states should take firm action to provide quality, inclusive education for all children, including those with disabilities, and ensure that no child is left behind by applying a gender and inclusive lens at all stages of planning, budgeting, and expenditure. Preparations must be made for proper infrastructure and support to ensure that schools are provided with necessary protective materials to keep all learners and teachers safe until such a time that there is no longer a threat to the virus. Governments must put measures in place to prepare learners for working class communities, and in particular, rural youth for schooling reopening. It must also be ensured that rural households have access to electricity, free data, and devices to access educational programs. There must be very measures to minimize the inequality in access to education through transforming the educational system in order for all of our children to have equal access to quality education. We must make public the scientific basis for measures taken in the epidemic and set up a public commission in each country, and SADC must SADC-wide involving states, civil society professional, domestic and private sector, as well as the World Health Organization to review the response to COVID, to identify lessons learned, improvements and investments to prevent and more effectively respond to any future pandemics. As a region, we need to form all alliances and contest interests that undermine the solidarity of the region by strengthening unity and common action amongst ourselves. In support of these demands, civil society in SADC hereby commit itself to the following actions. And therefore, at that point, I'll hand over to my comrade Glenn to finish off this and conclude the statement.
Thank you, Comrade Mavis from the Southern African Trade Union Coordinating Council. The Civil Society Forum, which is just concluded, brought together a range of formations and organizations from youth, women, children, the indigenous people, the trade union movement, young workers, and a whole range of other formations who are seeking effective change at this troubling time for our region and for our continent and indeed the world. The Civil Society Forum noted the abject failure of the 40th Heads of State Summit to even address or come close to resolving this crisis, not caused by the pandemic of COVID-19, but exacerbated by these conditions. For this reason, we are, as a civil society, needing to take action to support our demands. And in support of these demands, we commit ourselves to the following: to continue to build social solidarity and the support of local grassroots efforts to raise awareness, respond to the needs of communities, and contribute to national and regional level efforts to contain and mitigate the impact of COVID-19 on all our communities, particularly women and marginal groups. We further commit ourselves to develop, strengthen, and share knowledge and information with communities, vulnerable and marginal groups, and create a common portal and repository of local and national and regional efforts to combat COVID-19 in all member states. Governments alone will not be able to defeat the pandemic, nor will they be able to manage the crisis that is coming as a result of COVID-19. We as civil society will promote sector-specific coordination and responses in our effort, which will focus on small-scale farmers, migrants, cross-border traders, women, youth, children, persons with disabilities, and those living with HIV/AIDS, to more effectively communicate and engage with these sectors. We want to build a bridge between our communities and those who are in danger, and member states and SADC and the African Union, to ensure that coordinated responses are appropriate and effective in response to people's needs. Lastly, we will seek to promote accountability and transparency in all government efforts, particularly in ensuring the protection of human rights and the rule of law. Our leadership here from the Apex is represented by the president of SATUCC, the Southern African Trade Union Coordinating Council, who has overseen and stewarded our conversations. She will now make a concluding remark. Comrade Zingiswa. Comrade Zingiswa, you would need to...
Thank you very much, Comrade Glenn. And well, I want, as I make the concluding remark, just to go back and make an emphasis on the issue of Zimbabwe and make the point that many people would say that the issues in Zimbabwe are supposed to be resolved by the people of Zimbabwe. And we want to reiterate and say that if Zimbabwe further implodes beyond a point we have never seen before, it will become ever more difficult for this region to stand for prosperity in isolation. One only has to look at the effects, as an example, of Syrian crisis on its neighboring countries to realize that SADC cannot wait for the worst to happen in Zimbabwe. Zimbabwe's potential to positively influence the region is huge. Zimbabwe was once the breadbasket of the region, is now on the brink of starvation with its people scattered across the world. That is why, as civil society forum in this region, we have called and we continue to make a call for the African Union and SADC to have an important role to play in developing and industrializing the African continent. So we want to also say that, as the statement have alluded, that for us, it has been very disheartening to see SADC during its 40th Ordinary Summit congratulating President Mnangagwa of Zimbabwe for maintaining peace and stability. And we ask ourselves, where is the peace and stability when ordinary citizens in Zimbabwe are living in fear of criticizing their government? Where is peace when workers are beaten and tortured for protesting peacefully? So we want to make an emphasis as workers, in particular in the region, that our freedom in the countries where we reside cannot be enjoyed unless the people of Zimbabwe and those that are oppressed in different parts of this region are entirely free, that their rights that are enshrined in their constitutional democracies and also in the international labor statutes are recognized by their governments, who are also signatories to these statutes. So we want to make this point and say that the growth of the region, the growth of the African continent, lies on the unity of the people of the continent, and also for its leaders who are given power by the electorate to stand in the interest of the majority, in the interest of the poorest of the poor, in the interest of the working class, to advance the agenda that everyone has fought for the realization of democracy in the African continent. That unity is not going to be a unity of the elite, but it must be a unity that indeed sees Africa with no borders. Thank you very much, Comrade Glenn.
I believe, Comrade Zingiswa, you have spoken for the entire Apex Alliance, and we stand in full solidarity with the peoples of Zimbabwe and in the pursuit of an effective and just solution to the problems which afflict that country at this time. Ladies and gentlemen, that concludes the press briefing at this stage, unless there are any questions from the media.
We don't.
If not,
any have come through.
Sorry?
I don't see that there's any that have come through.
Okay, so with those last words, we conclude this press conference and invite the media practitioners to contact the organizations at the information provided in our statement, which has been widely distributed and can be accessed online. Ladies and gentlemen, thank you to our panelists and representatives of SATUCC, FOCCISA, and SADC-CNGO. With that, we conclude this broadcast.
Thank you, colleagues.
Thank you.
Thank you.